Now our next session is called Communicating in Times of COVID, and it's my pleasure to introduce Anthony Gooch, Director of Public Affairs and Communications at OECD. He's joining us online. Enjoy your session.
Good afternoon, everyone. I'm delighted to be able to join you to participate in the International Strategic Communication Conference 2021, and I'd like to thank the Presidency of the Republic of Turkey and its Communications Directorate for the invitation. In introducing me, as you said, I've entitled my presentation today, Communicating in Times of COVID. I think it's something that we have all shared, a common thread and theme for all of us in the last almost 2 years. The COVID pandemic is, by its very nature, a global challenge affecting all aspects of our lives and all sectors of society. Our normality is now shaped by cycles of disruption and adaptation. And this context has created fertile ground for uncertainty, increasing public expectations for accurate information and guidance. More than ever, the work of communicators is essential to help transform confusion into clarity. When the world turned upside down, the OECD didn't have a line, if you like, or a section in its 2020 communications strategy to confront the pandemic. As the saying goes, the most carefully prepared plans can go wrong, and we had to seize a once-in-a-lifetime chance to turn this challenge into an opportunity. With hindsight, today I can show you the different steps of our crisis communications plan. We were agile and reacted in a moment of heightened pressure, making sure that no matter the exceptional circumstances, we achieved our mission, better policies for better lives. But this was a story with many challenging chapters. And as the COVID crisis unfolded, strategic communications became a matter of vital importance. Before I take you through this journey, I just want to tell you that the elements that I've set out here in the slide that you can see, they look very carefully planned, they look very organized, and I think this is 2020 hindsight in part. The story I'm going to tell you does reflect what's in front of you, but it wasn't something that we had been able to plan for. And in those crisis situations, I think we would all recognize that we have to roll with the punches. We have to adjust, we have to adapt. And I think that's one of the key elements that any effective professional communicators need to have in their armory. So let me begin my story, chapter 1, getting the timing right. Our communications response to COVID-19 at the OECD started in earnest on the 2nd of March with the decision to advance the release of our major economic projection, the economic outlook of the OECD. And this gave us a head start as we became the first international organization to forecast the impact of the crisis of the global economy. But this was a risky business because in advancing our forecast, would we be ready in time? We follow some very strict timings for these elements. We need to get all of the economic data from all of our countries. We need to analyze it. We need to be confident that we're putting our best foot forward in terms of what's going to happen. And you can well imagine being the first international organization out there to say what the impact of COVID was going to be on our economies and on our societies was not an easy thing necessarily to do, but we went ahead and did it. And as you can see there, the impact was noted. It was known, whether it was the front page of the Financial Times, whether it was on major networks, for example, in the United States, in many other countries, including Turkey, where we enjoy huge coverage, Turkey being a founder member of the Organization for Economic Cooperation and Development that I represent. Let's move to chapter 2 now. In any situation like this, you do need to outline a vision and implement a strategy, but it's not the vision and the strategy that you had coming in. The analysis of COVID's impact on the economy was followed with a clear call to action by the OECD for a global response with the ambition of the Marshall Plan. This evoked a key historical milestone, and not just any milestone, it was the milestone that created the OECD. So for us to talk about the Marshall Plan had even greater resonance. And it helped to frame the pandemic as one of the greatest shocks of the 21st century, highlighting the urgency in addressing its multiple ramifications. In addition, we developed a crisis framework. Over the past year and a half, we have experienced a pendular swing between crisis and recovery, with many waves of COVID that we've all lived. I think we're up to the 5th now. But it's meant that we've gone from phase 1 to phase 2 to phase 3, but sometimes back to phase 1. And so even this framework that we developed while we were in this situation, we could see how the proportions that were varied. There was no linear pattern here. It was something that we really had to adjust and adapt to. And there is no question that COVID acted as a catalyzer of the digital transformation. Now, we've talked about the digital transformation so much, but I think we'd all recognize that it was really with the COVID crisis that everybody went digital. It wasn't just a buzzword. It wasn't just people saying it. And of course, again, in the communications world, we were always digital. But how many of us had to grapple with big organizations, governmental bodies, international organizations, where that real walking the walk of digital was taking a long time. And so, according to a McKinsey global survey, companies have accelerated the digitalization of their customer and supply chain interactions and of their internal operations by 3 to 4 years because of COVID. We're ahead of the game 4 years than we would have been otherwise. And let me now move to chapter 3. This is moving to action stations. What happens when you put yourself effectively on a war footing? And let's remember that we did use that language around the fight against this pandemic to draw those parallels. The need to strengthen our digital presence was a key priority for the OECD as well. And this is why in the communications department of the OECD, we led the way by deciding to create a digital hub in order to centralize the OECD's work related to COVID, rather than risk having it distributed in many different places. Why? Because we put ourselves in the shoes of people managing this crisis, people at the heads of governments, legislatures, at the companies, with very little time. What they needed was something that they could access quickly, easily, that would be relevant to them, where they didn't have time on their hands. And so we created this one-stop shop to be as useful a resource for those seeking evidence-based analysis and policy recommendations to try and help mitigate the crisis and subsequently to help build the recovery. We understood that policymakers and citizens needed the essentials, easily findable information in accessible formats. This also required adopting a multilingual approach. In a saturated information environment, having the capacity to connect with audiences in their primary language is vital to forging trust, respect, and meaningful relationships. Those who assume that everyone speaks their language commit a cardinal sin in communications. We produced interactive data visualizations showing topics, data on topics that populated public debates. You can see here acute care hospital beds, tourism, teleworking capacity of countries. Effectively, what we became was frontline information providers. The hub that we created hosts over 200 policy briefs with adapted recommendations. As we all know different sectors and businesses confront different challenges, requiring distinct policy approaches. And this is an example of how collaboration and strategic communication enhancing synergies across areas of expertise towards a common cause can really deliver. Now, if you are in a battle or if you are in a war, you need to know who and what you are up against. And beyond the huge health challenge that we were all up against, that COVID-19 virus that had never hit humanity before, containing the spread of COVID-19 required both a sense of individual responsibility and of collective consciousness. In a climate of distrust and knowledge gaps, it can sometimes be difficult to distinguish between sound advice based on facts and unfounded claims that seek to confuse or can confuse. Just as the pandemic exposed the extent to which our societies rely on the services provided by frontline health workers, the infodemic that accompanied the pandemic uncovered the importance of frontline information providers. Conspiracy theories on the origins of the virus, fake remedies, and misleading healthcare information have been our enemy in this battle, in a battle in which accurate information can save lives, and inaccurate information, well, we know the consequences that that can have. What can we do when scientific advice competes against anonymous users on Facebook? Take a look at this visual here. It's obviously intended in a humorous way. But what has happened to expertise over time? And what may happen to it in the future with the onset of artificial intelligence? And this is something that really bears great scrutiny. Now, to make sense out of this complex situation and its multiple ramifications, we created didactic infographics and initiated communications campaigns on social media, like the one you see on screen here, No Trade, No Vaccine, to make clear to the world that international cooperation was fundamental to achieving our goal. There was no way that we were going to get a vaccine if we didn't have all those countries working together. And it was news to me that Turkey is the third biggest supplier in the world for adjuvants, which are fundamental ingredients for the production of vaccines. And look at the rest: antibiotics, stabilizers, preservatives. We need needles, dry ice. And the list of countries that are the major suppliers is endless. This health crisis also exposed multiple facets of inequality, whether amongst workers within health systems in terms of access to digital communications, quality housing, but we also witnessed how when we unite our forces and build alliances, we can be greater than the sum of our parts. At the OECD, we strengthened our role as a forum for dialogue and exchange of best practices through the OECD forum in virtual format. We convened voices from academia, the private sector, science, legislators, international organizations, civil society, to understand how together we could find solutions to common problems. And for example, in 2020, November 2020, we organized an event entitled Communicating on Public Health and Vaccines in a Climate of Misinformation. What we wanted to do was make policymakers and policy shapers aware of the fact that perhaps we were on the cusp of getting the vaccine. But if we thought that that was the end of the story, not only did we need to get the vaccine, but we needed to get it into people's arms. And if we were confronting a situation which was already prior to COVID, we knew that the anti-vaccine movement was a strong one. Imagine what we might be up against when we were asking the entire world to get vaccinated in very quick time with a vaccine that had been produced quicker than ever before. Let's remember, 5 times quicker. The quickest we'd ever had a vaccine globally was 5 years, and we'd had it in 9 months. And that, of course, naturally could also increase people's understandable hesitancy. We have to understand that there is hesitancy on the one hand, and then there are those who, whatever vaccine you produce, it will never be satisfactory for them. That's the difference, if you like, between misinformation and disinformation. We also observed new partnerships blossoming to support those on the front line of the battle. Companies came up with creative campaigns to encourage social distancing. Here are some examples. BMW talking about flattening the curve. Rather than trying to sell cars, they were in the business of actually trying to get our citizens to follow the right path. And the same for a well-known sports brand that you can see here. From the US to Japan, restaurants mobilize their resources to help families that rely on schools for children's meals. And a well-known Spanish chef based in Washington, D.C. was on the front page of Time magazine, giving an example. Retail and transport companies help governments weather their storm using their production and logistical infrastructure to provide more medical supplies and ventilators. Take a look at that mask from Decathlon that normally you would use on a holiday on a beach somewhere. It turned into a ventilator. And the ACT Accelerator is an inspiring example to illustrate what could be seen as the restructuring of international cooperation before our very eyes, an unprecedented collaboration between governments, health organizations, scientists, businesses, civil society, philanthropists, to speed up efforts to end the pandemic by supporting the development and equitable distribution of the COVID-19 diagnostics, vaccines, and treatments. No one is above anybody else in a situation like this. Everybody needs to work together. If any one of those actors is missing, we can't do it. We all need each other. This was a perfect example of teamwork. And to my mind, I think it's also an example of how international cooperation could evolve in the future towards polylateralism, where we can recognize the roles and the functions of the different actors involved in these types of situations, not only in a crisis, but in normal circumstances. And now to chapter 6, very important, obviously, when you're in a battle, in a war. Are you winning? So I want to tell you a little bit of a story here about the importance of monitoring and evaluating what you do. Our impact since the hub launch, the COVID hub I was mentioning, is a testament to our efforts. The OECD is now a top online reference on COVID-19 policies, appearing on the top of Google searches. This is like getting to the top of Everest. So if you search coronavirus policy, the OECD comes up number 2 and 3 out of 2.5 billion searches right now. And that is, for us, it's certainly an extraordinary achievement. How much? Visits have been growing exponentially. Since we went live with the hub in March of 2020, we have seen a surge in audience reach, engagement levels, and interest in the OECD. And as you can see, interest continued to grow throughout the year. We've now reached 5.5 million. And in the last 3 months, we've had the biggest audience ever. So it wasn't back in March of 2020. It's now extraordinary. Where have we seen this growth? We've seen that we've earned a global attention and reach going well beyond OECD countries. Indeed, 50% of the top 20 countries visiting our COVID hub are from countries beyond the OECD. And our surveys tell us that our work is being used in particular by the public and private sector. And on this point, I recall how Turkey's representatives at the OECD made a point of telling us how Turkey and the Turkish government had found our hub especially useful during this period. All this data encourages us to continue providing timely and evidence-based insights and reminds us of our responsibility to continuously nurture our social license to operate. And now, every good book has a little epilogue. To conclude, I wanted to say that all this work wouldn't have been possible with some key unique ingredients: a clear sense of purpose, flexibility, and teamwork. This communication story has many protagonists. Some of them are unseen and unknown. People that have been working very hard whilst facing an overwhelming sense of uncertainty themselves, working from their homes, with their families, with their loved ones, anxiety, all of the things that we all felt. And this was a real test of resilience for my team. And they came through with flying colors. There's no way we would have achieved what we achieved without a fantastic group of people who were willing to work every hour that God sends at times. They were willing to do this. And I think it was driven by the fact that they did feel that sense of purpose and motivation of being first responders of information. We felt useful, and we knew that we needed to do things quickly. And that's the silver lining of this story, the incredible energy and solidarity that emanated from it. And whilst we struggle to fathom the ramifications of this outbreak, we can safely predict that care and strong social bonds will be vital, both during and beyond times of crisis. Thank you very much.